Well, I attended last year. It's a great experience, a good opportunity to network with other colleagues in the industry. I also had an opportunity at that meeting to learn more about CluePoints, what it offers us in the way of services and how we might be able to use those within our company to optimize our clinical trials. As far as the panel sessions, they were great because it's an opportunity for everybody to ask whatever their burning question is and get feedback from experts, because I think they're all bits and pieces of things that we want to know, and we want to know how do the experts implement in certain processes or practices within their company that we might be able to sort of shape to where it's useful for us. So it's a wonderful opportunity maybe to gather those ideas and get your creative juices flowing.
So when I attend these sorts of events, so the value that I see in attending an event like CluePoints Ignyte 2025 and my other engagements with CluePoints, whether those be online webinars, just for instance, RBQM Live, it's a great opportunity to not only hear what is in the CluePoints roadmap around product development, and for CluePoints to hear from me and from the other clients, the users of the system, and how to possibly make things better in the future, right? Or add a feature that's not there, or a functionality that's not there. But there's an added advantage or an added value as well that doesn't actually have to do with the technology per se. And it's the conversation in the room. It's the conversation, you know, from my perspective, being at a very large CRO, we have a mix of client profiles, and we want to best serve all of those clients the best that we can. In these sorts of events, it allows me to be in the room with some mutual clients and hear what other people are thinking about and what other people might be challenged with, but also what they've solved for. And that's huge. Love that.
Ignyte 25 has been fantastic. So I always feel really energized in these kind of things. So, you know, the Ignyte sessions are always great to get, people in the room that actually doesn't matter which company we're working for. It's reassuring. We're normally all dealing with the same issues. We always have the same goals in terms of, we're wanting to deliver the best possible, most robust trials that we can to get medicines to patients. And the way that we do that is to try and make sure that the trials are as good quality as we can.
I think it's very well deserved, not just for the work that Lynn has done for Pfizer, because she really took this from a concept all the way through to being implemented in every single one of our trials, which I think is a dream for many companies to be able to do. But more importantly, for our discipline, I think when I joined Pfizer 8 years ago, the most frequent request I got from peers is whether they could talk to Lynn and see how she managed to do what she did and implement what she did in the time frame that she did it. We had many a call because we truly believe this is good for the discipline, good for the industry, good for the patients, and not something to really keep secret, if you will.